So the next Ask ID that has come in is my teenage daughter is struggling with acne and she has been commenced on Duac by her GP. Could you recommend a skincare routine to go alongside this? So this is a really great question because unfortunately over 90% of teenagers will suffer with acne at some point. So it's really good to get into the right skincare routine. And then if you have to have a medical therapy added into that, sometimes they can be quite drying due to their ingredients. It's the nature of how they work to try and reduce that oil production. So it's really important that you have a good skincare routine alongside this. So I would suggest that in the evening time, somebody washes their face with a hydrating cleanser if they're going to use some prescription therapy that's going to dry their skin. And there's a range of products on the market, but some of my go-to favorites would be the CeraVe Hydrating Cleanser, which again contains ceramides, hence the name CeraVe, and these are going to help to restore that skin barrier alongside using a drying prescription agent. My other go-to favorite is the EltaMD Oil-In-Gel Cleanser. This is really nice oily texture. It's really good for taking makeup off, but then it turns into kind of a milky emulsion when you add water to it. So I love this for my rosacea prone patients and also my acne prone patients, and this is actually what I use every night on my face. Then you're going to pat the skin dry and put on your prescription. Now it's only a little pea-sized amount, so I usually tell people to dab it, like as in put the pea on the tip of your finger, go 1, 2, 3, 4, 5, 6, and to smear the cream across the entire face where you do suffer with acne. This is not a spot treatment where if you get a spot you put it on. It's a preventative treatment to try and stop the spots from recurring. Allow that to dry for a couple of minutes and then apply a moisturiser over it. Again, there's a CeraVe PM moisturiser, which is good, but also what I really love is, particularly with fair skin people, they often are a little bit intolerant of these prescription therapies, so I love a nighttime mask to try and help with that hydration. So my go-to is the Skin Recovery Mask from Elta. This is a really nice gel type of texture. It's not too heavy, but again, it's there to recreate that skin barrier, which unfortunately the cream is drying a person's skin if they're on these prescription medications. The other really important thing is that you're going to use any ingredients at night that have some sort of a topical retinoid in them, and a lot of these combination acne creams will have some form of topical retinoid in them. I would also suggest that it's really important to make sure you have a proper sunscreen in your morning routine. The EltaMD UV Clear comes in a clear version and a tinted version. So if you're suffering with acne and you have a lot of redness as this spots fade, you may like to use the tinted version because that will mask a little bit while you're waiting on your treatment to work. But if not, you prefer that it does come in a clear version. It's a nice strong factor in it, but it also has added ingredients such as hyaluronic acid to help with moisturizing and niacinamide to help with that staining of the skin, so to reduce that redness and inflammation. So cleansing, moisturizing and sunscreen should be added alongside any topical therapy, whether you are an adult or a teenager who's struggling with acne.